the word physician by the Devil's Dictionary. Physician is defined this way: one upon whom we set our hopes when we get sick, and one upon whom we sick our dogs when we are well. Of all the professions, the physician has to be the most paradoxical. A physician, brilliant and quick thinking. Yet for that, they are unable to write so that anybody can understand their writing except a pharmacist. They are decisive and disciplined, yet they're more preoccupied than an overworked inventor on the verge of a great discovery. The physician is the only guy I know who can put both hands in your mouth, ask you 3 questions, stare back at you, look into your nostrils, come up with an entire diagnosis, and still have his mind on his golf game that he's going to go to that afternoon. They are honest and principled, yet they lie through their teeth on a regular basis when they say, "This won't hurt," or "You're hardly going to feel this shot." The physician faces 2 unique pressures on a daily basis. It's the pressure of life and death. A wrong decision, an unexpected change in a person's body, a drastic reaction to a medication, and everything that they planned for goes up in smoke because of a risk. The second is the pressure of success and failure, combined with our sickness and the call for health. And it will so quickly all fall apart. It happens in moments, in seconds. And their years of schooling and decades of respect crumble in that moment with a threat of malpractice. If any profession on earth calls for a living, vital, incessant relationship with the eternal God, the one a physician does. And yet therein lies the greatest paradox of all. Many of those that deal with life and death situations in our lives are themselves neither prepared to live nor are they ready to die. That is not the case for the physician that I present to you this morning. I present to you a friend and a community servant, Dr. Stan Fleming. Stan, come join me. Now look, if you're gonna clap for the guy, clap. On or not on? Oh, we're on. Hi, Stan.
Good morning.
Keep talking here for a second. Yep.
Hello? Hello?
Is he on yet?
I don't think
Should be. If I punch it, are we going to squeal? Let's find out.
Testing 1, 2.
You're on.
I think we're on.
So before we get too far into this, you brought someone of rather great significance in your life to join us this morning.
I did. And, and before we start, I do want to say to everyone here and to you, thank you so much for inviting us, and for my wife, Martha, who's with us today.
Stand up, Martha. Everybody wants to see you. For all of the years of community service that Stan has had in our community here, she's been the best thing that ever happened to you.
By far.
There, see? Good. Let's get those things.
Yeah.
Martha, yeah.
38 years plus of great stuff.
Yay.
That's great. And she still looks young.
There it is. Well, we are dealing in this series of fearless living, and we have had some guests via video as well as on the phone, and we've got 2 more guests after this that are part of everything. But Stan has, at one point, he served with us as an advisor on the food bank and what we did, and he was a friend, and he and Martha got people to come, and they helped support what we were doing. And so as I got into this series, I called him 4 or 5 weeks ago. I said, Stan, I need your help. I need you as a physician to come and talk to people from your vantage point as a community servant one side, as a physician on the other side. This guy is more educated than all of us in the room put together. I mean, he's got a degree in zoology. He knows more than Adam did, and Adam named all the things. He is military service. You're a retired lieutenant general, correct?
General.
Oh, he's a retired general, everybody. Stan's my friend. So, he's also a physician, had family practice, board-certified physician, board-certified family practice. And I gave him 3 questions that we're going to go through. You don't have a video that talks about Stan's life. If you've been in the West, if you've been involved in University Place and on the west side of Tacoma for any number of years, he has been your councilman. He has been everything. And but most of all, outside of all of the accolades and all the things that he's done, he's a believer in Jesus. And so, Stan, I got a couple of questions. We're going to kind of work our way through. You want to say anything more before we get into the questions?
Wow. You certainly have a way of humbling your guests before they even say anything. So, no, I don't at this time. Thank you.
So we're going to deal with risk, fears, as it pertains to people and their health. Any of you ever been sick? Any of you ever needed a doctor? If you were born, you needed one. Any of you? Some of you might have had a midwife, okay, but you needed somebody in the medical community some point in your life. Let me see your hand. Okay. Then this morning is all about you. As it pertains to risk, you're the physician. You're all of those things that I talked about. You're brilliant, you're successful, you hold people's lives in their hands, you're trying to take pain medications and antibiotics. What's the greatest risk that you, Dr. Fleming, have faced as a physician?
You know, when I think about the risk that not just myself, but any physician faces, you know, first and foremost, number one, when anyone chooses to go to medical school and graduate, the oath that we take, the Hippocratic Oath, you can read through, it's a beautiful document, but the bottom line of that document is that you do no harm. No matter what you do and what you say and how you act, you do no harm with your patient. So that's number one. You know, number two has to do with access to care and ensuring that patients access their care in a timely manner. Because the risk you have when you delay care is that the morbidity and the mortality goes up significantly among those patients. And the interesting thing is women tend to be a heck of a lot smarter than men when it comes to accessing care, you know, without a doubt.
You had to say that, right?
I did.
You just had to say that.
Because there's a message here for the guys that, you know, listen to your...
La, 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 la.
Yeah. And that is really, truly listen to your bodies, listen to yourselves, listen to your spouses, listen to your significant other. Because, and why the mortality rate among men is higher is because they delay care longer than they should. On there. You know, number three has to do with what I call polydoctoring, and that is we live in a system today where more is the better when it comes to health care, and if I go to not just one physician, but if I go to 10 or 12 or 15, I think I'm getting better health care. If I think I'm having, you know, indigestion, I go to my GI doc. If I got a kidney problem, I go to my nephrologist. If I have a bladder problem, I go to my urologist. And the challenge with that risk is the fact that every physician and every healthcare provider is very well intentioned. And they want to do what's right for the patient. But what happens in the end is the fact that every physician who doesn't know what the other one is doing, or every clinician that doesn't know what the other one is doing, is prescribing what they believe is the right thing at the right time. And so what you end up with is what we see, drug-drug interactions. I can't tell you the number of patients I see on a daily basis who come to me, and they'll say, you know, I was told my loved one is passing away, and we don't know what it is. And so when we sit down and look at all that the patient has seen, the number of physicians they have seen, the number of drugs that they're taking, it's very evident. I've said to a number of families and loved ones, true, your loved one is dying, but they're not dying from a disease. They're dying from all the drug interactions that are taking place. And so it's important, it's so important that that individuals and families have one provider that coordinates that care and helps to synchronize that. And if you have a competent primary care provider, they should be able to manage 85% of those issues that you bring to them. You know, and that other 15% can be reserved for the specialist. And then you put together around that patient a very solid healthcare delivery plan that works for them. And it's important because when you look at our environment that we live in today, we have 90 million Americans who live with chronic disease.
How many is that?
90 million. And then, so if you think about how many people are dying from chronic disease, 7 out of every 10 Americans will die from a chronic disease problem. So it's so important, it's imperative that we synchronize that health care and that we don't get out and start doctor shopping and thinking that we're getting better health care, because in most instances you're not.
Question number 2, your experience in helping people manage and steer through failing health. They've got it, they know it, but how do you help their family come around them in those moments? How do you as the physician deal with failing health issues individually and family?
I think number one when it comes to failing health in individuals is number one, it's sitting down with the patient and having a very realistic conversation and setting realistic expectations. And what I mean by that is so oftentimes people will come and say, I have a little issue here, and I think with a little help we'll get through it. And the family has expectations that are much different also. They're higher. My loved one's a little sick, you're going to fix them up and they're going to be fine.
You can't fix everybody?
And I wish I could, but I learned a lesson when I was a resident, and that is I may be a great doc, but I'm not God.
Okay.
And I'll talk about that in a little bit. But what we do with loved ones that have that failing health is setting, number one, is realistic expectations of what can and can't be done. Not every condition is treatable. Not every condition can be. Not every individual can be saved, at least on this side of life. Yeah. I had a recent case where a family came to me and they said, we've been to 4 doctors. And they said they just need to come here and spend some time with you, and a little nutrition, a little rehab, and he's going to be fine. He's going to go home, and we're going to have a great summer. And I said, okay. And I went and saw their loved one, and I came back to the family, and I said, your loved one is going to be dead within a week. And they were blown away by that. Now, one of the things I do in my practice is we do subacute and acute care for patients. So we see a lot of this on a daily basis. And the family was stunned by that. And I said to them, I said, I am so sorry, but this is what we're dealing with. And they said, but he was great 3 weeks ago. And the doctors just said, he was just a little tired. All he needs is some nutrition and he'll be fine. And I said, but here's the reality. And I laid it out for them. And it was very hard. It was a hard pill to swallow. And that's not an exception. We see a lot of that. So setting realistic expectations is very important. Number 2 is preparation, and that is preparing the family, preparing patients to face that transition in life. When you look at advanced directives, only 20% of the patients we see have an advanced directive. How many people even know what those are? How many people even know what advanced directives are? Because for those who don't, it's okay. But advanced directive is what you're saying to the physician. Should I become to the point where there is no hope to save me, or I run into an acute situation that I needs immediate intervention, here's what I want you to do for me, A, B, C, D. In light of not having that advanced directive, we're obligated to do everything that we possibly can to pull you back from whatever that condition may be. And so having that conversation with the patient, having that conversation with the family, having that conversation with friends avoids a lot of crisis at the time, because it's really a bad thing to try to be making those decisions when you're in the middle of the crisis versus before getting to the crisis. And understanding even what an advanced directive is, because you'll hear terms thrown out there like DNR, do not resuscitate. Do not attempt resuscitation. Limited intervention. And that means, or comfort care is another term. That means something different to every single person, including the physician who's treating. So it's important that you're very clear in what the terminology means to you, as well as to the family, as well as to the provider that's taking care of. And so those are things, and having that conversation of transition in life beforehand versus when you get there, makes it a lot smoother in setting those expectations.
Last question. You're the doc. You see a wide variety of people over your practice years. What role has faith played in your patients? With faith and without faith?
I think this is my favorite question because so oftentimes people will come and they will give you a very nice story about this is what my ailment is. And I can't tell you, and I have to back up a little bit and say, when I first went into medicine, I actually had a chance to go into the ministry. My bishop at the time one day said, Stan, you're going to make a great minister and you should go into the ministry and I'm personally going to send you to seminary. And I said to him at the time, I said, Bishop, God's going to forgive you for you know not what you say. Because ministry is a calling and I didn't have that calling at the time. And so, I was called to a different path and that was in the area of medicine. But so oftentimes people will come to me and they will give me a very elaborate story and I will listen to it and then I'll say to them at the end of that, you came to the wrong doctor. I said, the doctor you need is one who's a pastor or a priest and not a physician such as myself. And you need to go find a parish or a church and a pastor who can feed that spiritual need and help you get through whatever your situation is right now, because a pill's not going to solve it. The other part I find, as I said earlier in the conversation, so oftentimes physicians like to think, we are the be-all, end-all, when it comes to dealing with life and death. And I will never forget my first time as a resident in an ICU dealing with a patient who had coded, who had a heart attack and arrested. And I was directing that code, and we were working on that patient, and we worked on that patient. And about after 45 minutes of working on the patient, the nurse, who was a very smart nurse and very insightful, said, Doc, do you think we ought to call this? And I said, no. I said, no one dies in my ICU because I am the doc here and no one dies. We're going to keep coding this person until he comes back. So we kept coding him. And finally the nurse said, excuse me, Doc, can we step out and have a quick conversation? The nurses will kind of manage things and we need to talk real quickly. So we went out in the hallway and she said to me, you're a great doc, you're a brilliant physician, but you're not God. And when God calls you home, it doesn't matter what you're going to do, you're going to go home. And I have found that in my time in medicine and even today in my practice that I have, that those individuals who have faith transition life so much smoother than those who don't. And my heart truly aches for patients who don't have that faith and that comfort of knowing that there is life beyond the life that we have. Just recently, in fact, in the last 2 weeks, I've had two patients, both who unfortunately passed away, who said, their dying words were, don't you dare let me die. I've got to stay on this side. And I said, I can't stop that. I can't stop that because there is a power much greater than me who has made that determination that no matter what I do, you're going to go. And so my role as a physician changes very dramatically at that point in terms of trying to heal that person or pull that person back or hang on to them. It really is to help them transition smoother across that bridge of life into the next life. And if they can, make that amends with God before they get there, then it's a wonderful celebration. So oftentimes, and this will be my final comment, that we so oftentimes mourn about our losses versus celebrating them, because and what we need to do is learn to become less selfish, and that's not a negative thing, but less selfish about wanting to hang on to our loved ones and become more selfless and celebrating the life they had with us, but celebrating the life they're about to enter into. That's the important thing. So with that, those are I think things that we can do, and how faith really plays out in living and in passing that we do, and we all play a role in that. So thank you.
Stan Fleming. Greg Clark. Greg, okay, don't come this way. You got to go back to my office. Al, while he's going, I want you to sing a song with me. You ready? I feel Jesus. I feel Jesus. I feel Jesus in this place. Yes, my soul cries, hallelujah. I feel Jesus in this place. I feel Jesus. I feel Jesus. I feel Jesus in this place. Yes, my soul cries, hallelujah. I feel Jesus in this place. Oh, I feel Jesus. I feel Jesus. I feel Jesus in this place. Yes, my soul cries, hallelujah. Oh, I feel Jesus in this place. I feel Jesus in this place. I feel Jesus in this place. Jesus, in your words, the words that you gave Stan, and in the comfort and the care, we feel Jesus in the house. We feel Jesus in the house in the cry of the baby. We feel Jesus in the house in the tear of the saint. We feel Jesus in the house in the shout of the people. We feel Jesus in the reading of the word. We feel Jesus in this place. East side, west side, front side, back side. Jesus in the house. And our souls this morning, we do say hallelujah. Hallelujah. Because we feel Jesus. We feel Jesus in this place. Fearless living, facing failing health. Greg's not back. Greg, you're back. There you go. I couldn't find you. You just slipped in. Come hither, dear brother. I got 14 minutes to preach a 28-minute message, so here we go. Here's from the pastor. You heard from the physicians. Listen to the pastor for a minute. We have a tendency in our lives to hang very heavy objects that weigh a lot on very thin wires. John, get up here for a minute. Matt, you went too quick. I need you on this side. Matt, go on the top of me and go to the front. Greg, you're going to go right there, and you're going to, guys, don't let it hurt you hard, but be in the center. You're all the way over there. Get in the center over here, and you're just, you got several cuts here to make. So, see, we have a tendency to hang very heavy objects on very thin wires. We hang them. The weight of happiness gets hung on the thin wire of health. The weight of peace gets hung on the wire of possessions. The weight of security gets hung on the wire of our savings accounts. Our health, you realize something as tiny as a blood clot smaller than the size of a pea, if lodged in the wrong place in your body, can suddenly turn your speech into a slur and reduce your steps to a shuffle. And in that moment, cut, snap, will go the wire. Of all of our possessions can go away. A brush fire can come. A hurricane can blow in. A tornado can rip through. And in that moment, homes and appliances and furnitures and beds that you were sleeping in one moment and cars that you were driving and the peace that you had, cut, snap, everything as heavy as peace now is cut into inseparable linked moments because our possessions are gone. The weight of happiness on the thin wire of health. You're good 1 minute and you take it for granted. And then the wire that is very thin is cut and snap. You miss a limb. You have a scar in your chest. And what was holding you is quickly gone. The weight of peace on the thin wire of finance and health. Let me tell you my story real quick. I was living the dream about 10 years ago. Great position, good job, had money coming in. I had unbelievable health. And suddenly, overnight, my identity is stolen. The consulting business that we had created with 100 churches dries up. And of all things, we start a church called Grace Place. And 11 months later, Jane is diagnosed with stage 4 cancer. And in 6 months, she's gone. And everything that we thought we had, snap, snip, cut, and it's all gone. The heavy weight of love on the not so thin wire called relationships. Now, this is better than all the others in front of it. Because with the relationships that we have, when they fail, and if you know what a failed relationship is, be honest enough, you can raise your hand. When you're in the middle of a failed relationship, here's one thing that you have, and the hope is that Mr. Right or Mrs. Right will come along again someday, and what was broken in your heart and what was taken from you and what you lost at the graveside can be restored. But this is the thickest, but it still, in a moment, can go snap, cut, and it's all gone. Am I making my point? Yes. I've got a piece of bad news for everybody in the house, and this is the final one. I read a scientific study this week. Here's the scientific study. Now, it's got to be true because I read it on the internet. The scientific study says people who breathe are at a risk of dying. Apparently, the act of breathing in and breathing out on a repeated basis will without doubt lead to your death. So for all of you that are breathing this morning, that's got to be disturbing news. Knowing that it's 100% accurate, it's really scary. Woody Allen says this: I don't want to achieve immortality through my work. No, I want to achieve it by not dying. So the question this morning is, here's a fact and then the question. The fact is, unless Jesus comes and takes us out of here, we're all going to die. And we're going to face a process to die. And that process to dying, you're going to involve a physician and a lot of other people. It's going to be really expensive. I can tell you how really expensive end-of-life care is. End-of-life care for Jane for 6 months was just over $787,000. I know what it costs. We're all going to face it. What are you doing with the days that you have between now and the breath you're breathing and the one that's going to be your last? Because without the rapture taking place, you're going to face it. How are you going to make sure that the breaths that you've got between are really effective and they're not frivolous and you're not wasting them? What are you doing with your next breath? The next breath. Fear is a pretty powerful motivator, isn't it? Fear. Fear on one side is healthy and on the other side it's paralyzing. Fear. Fear keeps us from reading the newspaper or turning on the television or listening to the radio. The food that you eat, it could be dangerous, you know. The clothes that you've got on this morning, they could be unsafe. Don't anybody undress. Where you go on your vacation, it could kill you. Have you seen that show? The show of people going on vacation, the vacation turns into a disaster. Oh my word. Then you know what the next thing they're going to find out? If you eat too many Reese's peanut butter cups, it's bad for your health. Think about the car you drive. Some of you will remember the day when you didn't have a seatbelt in your car. Then you got seatbelts. Some of you will remember that you didn't have a shoulder harness. Now you got shoulder harnesses. Oh, car seats. And now you got to have, no, just a car seat. Now you got to have a contraption. And you need an engineering degree to put it in. We barely had brakes, and now you got anti-lock brakes. You didn't have airbags, and now you got them every which way. Upside, downside, inside, outside. Someday we're just going to drive marshmallows. There is a lady who was a Swiss-American psychiatrist. She's done an amazing amount of research and work on death and dying. As a matter of fact, that was her entree book into the world scene. It was a book simply called On Death and Dying. Elizabeth Kubler-Ross is her name. She introduced the 5 stages of grief: denial, anger, bargaining, depression, and acceptance. Those are the 5 stages. The 5 stages boil down to a couple of things that she says, and I'm really trying to hurry. Life falls into 2 fundamental fears: the fear that we will not survive, and the fear that we are not good enough to survive. It's the fear of not making enough money. It's the fear of not having the right insurance in place so that you can go on and live. It's the fear of not being good enough. It's the fear that you're afraid of getting sick. Because who's going to be there? Will my family actually show up? It's the question of 2 fears. And they both paralyze us. Both paralyze us. Matthew's gospel records a story of a man with friends in a boat on a sea called Galilee. The record shows that they have toiled all night and have gone really nowhere. I have gone on the Sea of Galilee. It takes about 2.5 hours to go from Tiberias over to the land of Gennesaret. That's on a nice day without a powered boat and the wind going the right way. The indication is that this night they have been on the sea for 9 hours. They have been bailing water and they have been fighting the winds. I know what it is to fight winds. Living in the Midwest, occasionally out of the prairie provinces of Canada, or coming up, Lauren, you know what it is to fight the winds. You grew up back there. The wind sometimes you can just stand. And you go nowhere. That's what this boat was doing. It was going nowhere in the middle of a storm, which is exactly what happens when we begin to face failing health. It's like we're facing an oncoming wind and we go nowhere. It's the 4th watch of the night. Have you ever thought about the feeling of the wind against your face when you go nowhere? You have worked and you've worked and you've worked. You've worked to eat the right foods. And you did everything the doc says. And you walk in and sit down because he doesn't see you this time on the table for the exam. He brings you to his office and says, we need to talk. It's never a good day when the doc takes you to his office and says, we need to talk. Some of you know, okay? You took one step forward all your life long, and suddenly now you're not two steps, you're 3, you're 4, you're 5, you're 6, and your health has failed. The disciples are battling the winds. See, I've come to learn that there are 2 kinds of people. What you don't know is I have a clock right there, and I keep looking over at my clock. There are 2 kinds of people in the middle of failing health, and they're just like Peter and Jesus in a boat. There are sinkers, and there are walkers. I had an uncle who taught me how to swim, and he was a floater. He would just go out there, and he would lay and put a glass of Coke on his belly and just sit there all day long. Squatty body, me, I am a sinker. I can't float. I can tell you, I've been at the bottom of the pool. I know what that view is. I only learned to swim because I moved my arms so fast that I got all the water out of the pool. And that's exactly what we do when we face failing health. We will flay our arms, we will scream and yell and in hopes that we can get all the water out of the pool and we can walk. Peter knows what it is to be a sinker. He also knows what it is to be a walker. Peter knows what it is to look at everything going on and give up. And yet the one who can calm the storm and speak to the winds and the waves all the way around us says, the song that they sang this morning is so apropos for today. Turn your eyes upon Jesus and look full in his wonderful face, and the things of earth grow strangely dim in the light of his glory and grace. See, some people would rather stay in the boat. They'd rather not take a risk. They would not want to prepare for the end of life. You know, there are a bunch of people every year who do not want to get out of bed, and yet there are 500,000 people a year who are treated in emergency rooms for falling out of bed. There are people who want to shut the window and close the blinds. There are 10 people who end up dying a year because they got their neck wrapped around the Venetian blind cord. 10 people a year because they shut the window and didn't want to get out. If you are so filled with fear that you cannot take the next step and even face the fear of failing health, you pick the wrong species to be born into. The fear of not being good enough, the fear that you can't survive, the fear that you're going to go down and you can't get up. That fear. No one likes failure. I hate failure. But the minute you stop trying is the minute that you have really failed. The minute that you stop living, that's what happens when you get caught up in dying. You stop living. The breath that you're taking now becomes paralytic and you can't move, and you're the victim of the circumstance. The cost of not getting out of the boat, the cost of not taking the risk, the cost of not saying, I'm going to get to the dock, the cost of not coming to the altar, the cost of not... If I could give you one word, and here it is, don't be afraid. If you saw my post, there are 365 don't be afraids in the Bible. Duh. What's keeping you? What's holding you? It's the fear of facing whatever. By choosing faith in a moment, you win over fear because you're going to do something. Get out of the boat and try it. The worst you can do is get wet. If you stay in the boat, there is a 100% chance that you're never going to walk, and you're going to live in your fear. Waldo Ralph Emerson said this, and I close. Do not go where the path may be. Go instead where there is no path and make a trail. The fear of facing failing health. I just wanted to go there. Pastor, I want to talk about it. I don't. Okay, don't. And where are you going to go? You're going to go there. And then you're going to walk into Dr. Stan's office and say, help me. And he's going to go and say, you should have been talking to Danny all along. And I'm going to be saying, why weren't you talking to Jesus all along? The risk is not doing. The risk is do something. The plan. Stan. And I cried to the Lord, and he heard me. Oh, but I want to talk to him about, I'm only talking about it really sick. I don't want to talk. And I cried to the Lord, and he heard me. And delivered me from my fears. Gracious God, this morning, thank you. Thank you for your word. Thank you.